My name is Jason Yuzakonis. I live on the North Shore of Massachusetts, just north of Boston. Just turned 50 years old. I have two young children that are 13 and 10. I had to think about that for a second. And I work in the running shoe industry, generally a happy, easygoing guy. There wasn't, for me, a really obvious symptom at first that said something was wrong. Back in 2018, I think it was February, we went on vacation down to the Caribbean on a cruise. And I remember trying to run on the top deck and feeling like, I feel a little tired, but maybe it's just the heat and humidity down here versus being used to the New England winters and a lot of late nights while you're on vacation. Maybe that's just catching up with me, no big deal. And then as we got into the spring, I just remember feeling unusually tired when I was out running. Again, sometimes those things happen, but as I got into late April, early May, that's when things really ramped up with my disease. And although I didn't know what it was at the time, I would get 3 or 4 minutes into a run and it felt like my body was shutting down. It felt like blood and oxygen just flat out was not getting out to my legs and muscles in general. And it turns out that was sort of the case. At the time, I thought it had something to do with my heart. And that's when the journey started in terms of trying to figure out what was happening. Did not think it was anything overly serious, certainly not cancer. That was not on the radar. That's what led me to start the process of trying to figure out what was going on. I just started with my primary care physician, just called in and said, I'm not feeling right. I think we probably need to take a little bit of a deep dive into my blood work to see what's happening. And that's kind of where it all got started up. My body felt like it was shutting down. I wasn't overly symptomatic. There were no other symptoms at first, other than the extreme fatigue while I was running. In retrospect, certainly over those previous months, there was some degree of fatigue, but sometimes, you just chalk that up to, I'm not a young guy anymore. I've got young children. I'm working a lot. So you just, something serious isn't really on the radar. They went in for blood. The doctor called me back and said, yeah, you're very anemic. In fact, we want you to get back in here tomorrow to make sure your blood counts aren't crashing. At least if they're stable, then we're going to get you to a hematologist. But if they're crashing and there's some sort of internal bleeding, you need to get to the emergency room. So I went in the following day and everything at least seemed stable, but still very anemic. And at that point, that's when the doctor said, you need to really get to a hematologist. So we'll set up an appointment for you and get you going. When I went in to see the hematologist, and then they did a deeper dive into the blood work, ran more tests. And then that's where things really ramped up. The hematologist called me that evening, and I remember exactly where I was in my living room when I got that call. And he said, there's some real concerns on these blood tests, and we think it might be some type of leukemia. I broke down in tears right away. My heart started racing. I mean, my life was changed in that moment right there. Like if there are certain points in this journey that I can definitely point to where my life was forever changed in that moment. My wife was sitting right next to me. We're in the living room, just sitting on the couch. I had the phone on speaker. I mean, I remember every little detail about that conversation. And it was frightening. It was truly frightening. And I broke down, and my kids were upstairs at the time, and they were really young. My son was getting ready to turn 4. My daughter was 7. And you just automatically start going to that, thinking about, wow, am I going to be around to help them become adults? There's certain points along the way that even thinking about it today, 6 years later, that it's sort of, it's difficult to think about. The good news is I feel more confident that I will be able to see them become adults. But there's always that, it's always in the back of your mind. It never leaves you. And obviously my wife as well, just the idea of leaving her at a young age. Those are painful things to think about. It's funny. I try to talk to the kids every so often just to see how they're doing, where they're at, what do they think about it. And I think at the end of the day, they're still a little on the young side to get, to really truly understand. And that's okay. They're young. They've got their lives. They've got other things they're consumed with. that was one of the first questions I had when I got to the doctor that I'm now seeing is, will I see my kids grow up? So that is sort of the main driver, I think, when you get a diagnosis like this at a young age. Next up, he said, we got to get you back in for a bone marrow biopsy. And those aren't fun. So we got the result. I went in to do that. He, again, after the bone marrow biopsy, started trying to guess as to what the condition could be or what the disease could be. He had a hard time getting a sample from my bone because it was pretty packed with lymphoma. So I said, well, why would it be so difficult to get a sample? And he said, well, we're not sure, but it could be myelofibrosis. But I also had a family friend that worked at a lab at a hospital in Boston, at a larger academic center. And I'd been texting back and forth with her. I was really, nervous and frightened. And she was really good at times. She said, relax, calm down. We'll get you into Boston. We'll start doing some work here. And I know a couple of really good doctors. This is actually another hospital that is not where I am now. I can go into that in a little bit, but this is another hospital that I ended up at. And this was more of a lymphoma doctor, not necessarily specific to what I have, but still at least getting closer to being more specific to what I have. So she was much more informed on the world of non-Hodgkin's lymphoma. So I went into this hospital and met with that doctor and then the first meeting, she said, well, we weren't too crazy about the tissue sample that you got from your first bone marrow biopsy. We'd really like to get our own sample. And I remember looking at her and said, you want to do a bone marrow biopsy right now, don't you? She said, yep, this is literally only a couple of weeks after the first one. So I just remember rolling over to my stomach and saying, let's get this over with. But it was a lifesaver. One of the other things that first hematologist said, and again, very well-intentioned, but at the end of the day, something seemed off. He was ready to start treatment and didn't have all the info and said to me, well, all these forms of non-Hodgkin's are treated the same way with chemotherapy. And I thought, that didn't sound right. The next doctor that I was with said, well, no, that's not really true. We need to get more information and we might be able to base the treatment on the information we're going to get from this. So I felt a lot more comfortable at that point. Like, okay, this sounds more accurate to me. I'm more comfortable with this. So we're going with this doctor. Fast forward about a week and a half, they're waiting to get results back from that bone marrow biopsy. And I started feeling some pain underneath the rib cage, which is the spleen getting larger. And I'm starting to notice other symptoms. Things are ramping up, and called the doctor and she said, what was mild is becoming less mild. Come in tomorrow, we'll give you the results of everything, and we're going to get you going with treatment. So at least I felt comfortable that I was on the right path at that point. I started treatment in July of 2018, and the challenge at that point in time is that my health insurance, the health insurance I had, Dana-Farber didn't take at the time. So at that point, I'm starting to learn about what I have, and I start to realize, oh, there's this whole team of specialists at Dana-Farber that really know this disease, but wasn't able to go there initially. So I stayed with this doctor for a year. This doctor was really good. I wouldn't say there was as much back and forth in retrospect. Now that I have a better feeling as to what that doctor-patient relationship should look like. This doctor was really good, well-informed, but there wasn't much back and forth. There wasn't this, here are the options, what do you think? So at least but I still got on the right path ultimately in terms of the treatment, and I stayed there for about a year, and then we changed our health insurance pretty much specifically so I could start going to Dana-Farber. And the treatment initially worked really well, and it was almost a year after I got diagnosed when I had my first meeting with the team at Dana-Farber, and it was just night and day, in terms of the approach they took. Not only they confirmed that I was on the right path in terms of treatment, but they just made me feel so much more at ease. My first year was loaded with anxiety. I had to go through a process every day of getting myself in the right mindset. it was a huge challenge. And I still have that to this day. I still take a lot of what I learned in that first year about my daily approach. But I dealt with a massive amount of anxiety. And I have to say that after that first meeting with the team at Dana-Farber, I just felt so much better, so much more in control. I felt confident that I would see my kids grow up. Let's put it that way. The first treatment, they started me on a targeted therapy. And they also gave me, I also got 8 infusions of a type of immunotherapy. At the time, the combination of the two was showing to be really effective, particularly for people in my situation. And I responded great. I started to run into a few side effects that weren't overly threatening, but annoying. And I think this was in October of 2020. And I remember, having a conversation with Dr. Strosik about it. And my thought at the time was maybe we move to a smaller dosage, but what do you think? And she said, well, we've got a newer version of that same type of targeted therapy that is showing to be really effective, and side effects are much more improved than that. So we moved to that in October of 2020. And since then, it's worked really, really well for me. I'm feeling better. I've got to get back to my daily life of work and raising kids. But every day you wake up with this massive amount of anxiety. So how do you get through that? As I mentioned earlier, I'm a runner. I hated the idea that I seemed to have lost control of my own health. So I changed my diet dramatically. I kind of dove back into just fitness in general. And as soon as I could get back to running, I got almost sort of fanatical about it. But I think in terms of the mental health portion, I spent a lot of more time each morning in meditation, just thinking about my body healing. Whether people believe that's helpful or not, it helped me. And I think ultimately the main message there is for anyone else dealing with a situation like this, whatever you can do to get yourself in the right mindset, so that you can move through your day and get back to a normal life. It takes a village, and that is definitely the case early on when you're going through a diagnosis, and especially if you're having to go into a center for treatment. You need help, and you can't be shy about asking people for help. And you'd be surprised when you start asking for people for help, how many are willing to jump in. Because my wife had to go to a lot of appointments with me. She went to a lot of the infusions when I got infusions early on. So we needed help with our kids. My wife was huge in that journey early on, going to the appointments. I'm a mental wreck in some of these appointments, super stressed, and somebody that needs to be there to pay attention and take notes. And she was great doing that, and shouldering a lot early on. So I couldn't have done this without her. And at the same time, you do need to ask for help from others. And we were very fortunate that we did have others that were ready to jump in and help out, take care of our kids while we were spending the day in Boston, doing what we needed to do. I'm pretty stubborn by nature, and I'm not good at asking for help for myself. But that said, in that moment, I had to think about there are others to think about. I have 2 young children. I have a wife they need to be taken care of, and my wife needs some help as well. So I think at the end of the day, you have to just put aside the selfishness and the stubbornness, do whatever you can to get past it, because there are others to think about here. It's not, when you're going through a cancer journey, it's easy to think about it. It's all about you, but there are others that are dealing with this too. And you have to think about the others in this situation. Be proactive, do whatever you can to improve your own life and try and improve your outcome. But I would say most importantly, find the right doctor, get with the right doctor. It's okay to get it's good. In fact, you should get multiple opinions, especially in a situation where you have the time to do that, and then find someone you're comfortable with and go from there. That would probably be the 2 biggest things I would say, is do whatever you can to improve your own health, because that'll help improve your outcome, and then get with the right doctor.